Everyone, welcome to today's video. So today we are going to talk about Medtronic India, the life, the work culture, the platform of Medtronic India. How is life there? What does the typical life of a MBA graduate working for Medtronic India looks like? So when I was doing my MBA, I was involved with Medtronic India for a period of 4 months from January 2022 to April 2022. I was working on a live project in their digital marketing section, so awareness of neuroscience therapies that Medtronic was promoting. I was looking after the digital touch points that they can explore and how they can market their products better so as to raise the awareness about neuroscience therapies among doctors and patients through the digital touch points. So what is Medtronic India? What does it do? Go and read about Medtronic India if you do not know. Medtronic all over the world is one of the best companies in the space of healthcare. So today's video will also give you an idea of how a healthcare company functions and how is life and work at a healthcare organization as well, and also the feel of a life project during your MBA course. So this is my first video about a life project that I'm doing with Medtronic India, that I did with Medtronic India on my channel as well. This was a live project of 4 months, as I told, when I was in my second semester of MBA, and I continued till the end of my second semester, and post which I joined my summer internship. So the end of the stint actually overlapped with my summer internship at Titan as well. At that point of time, I was doing 3 internships, to be honest. I had just joined Titan as a summer intern around 18th April, and it was overlapping with Medtronic India's end stint last 2 weeks, and also with Roha Precision Systems Development Live project as well that I was doing with a startup called Roha Precision Systems Development. To cut the conversation, basically, how does life and work at Medtronic India looks like? So Medtronic India, as I told, is a healthcare company which basically promotes the therapies with the help of artificial intelligence and advanced technologies. It brings across therapies of treatments that are extremely difficult to get through regular treatment that we see. They are the manufacturers of equipments and technologies and therapies across the world, which has been transforming lives, transforming nations with the use of technology in healthcare space. So they are the ones that bring these devices, like for Parkinson's disease, for other neuroscience therapies, urinary incontinence, all of these problems, they have special therapies and equipments to deal with them. And Medtronic India is the India division of Medtronic that deals with it. It is a global organization, I would call it, and it is just after Johnson & Johnson. It is placed in terms of healthcare equipments and therapies space. So life at Medtronic India was extremely beautiful, because why do I say this? What made Medtronic different from the other organizations? I think the culture, the work culture, how they support their employees, how they are so employee friendly, and whatever you need, every meeting. So we were basically assigned a manager who was looking after marketing in particular of the neuroscience therapies. So she was one of the leaders in the space. We had a proper interview. So the selection procedure was a form was floated where we needed to fill up that what ideas do we have about digital marketing in the neuroscience therapy space or in the therapy space to promote it among the doctors and patients. We had to give a brief, brief of the ideas that we were having, and after that, some of the CVs and the ideas were shortlisted, and we had to do it in a team of 3. So I was accompanied by 2 of my colleagues as well, 2 of my friends from VGSoM IIT Kharagpur, and in teams, there were basically 3 projects that were floated, and digital marketing awareness. Innovative digital marketing tools for raising the awareness of neuroscience therapies was one of them, where we qualified, and thereafter we had an interview with one of the top officials of Medtronic India. She was looking after the marketing division of neuroscience therapies, and after a good interview session, our team was selected for this project from VGSoM IIT Kharagpur, and we served 4 months in Medtronic India trying to solve their digital marketing problem as a whole. And the ideas that we suggested were extremely appealing to the senior management as well, like gamification of the platforms, creating a community where people come together to raise awareness as a whole, influencer marketing, kiosks, interactive kiosks at hospitals, and API integrations with the medical chains like Frank Ross and Apollo clinics, where the patients of Parkinson's or neuro therapies treatments actually go to visit. So all of these ideas were some of the ideas that we actually suggested and presented in front of the top management after a rigorous primary and secondary research over a period of 4 months. Life there was extremely good because every week we would have a meeting with our mentor from Medtronic India. She would come, she would brief, and she would be very enthusiastic about how we are progressing, where we can improve. She would exactly tell that this is what we are not supposed to do. We have certain policies, and those we are very strict to those. We cannot do this, we cannot do that, but what we can do is maybe tweak this a little bit and do it this way. So how the guidance, how the hand holding was done to, we didn't have a feel of the culture of the company, but when we got in, every step she told us that this is what our company looks for, this is what we are looking for, this is what we stand for. We are a community and we are trying to influence people's lives. We are trying to make it better, and in that means we are not going to take any unethical or any other route, promotional route. We stick to these principles, and this is what we stand for, and these are the ways of marketing that we think will be helpful. And every idea that we were suggesting, she was not discarding them. That was the main virtue of the mentor and the company as a whole. So whenever you give an idea, they do not discard your idea, they just give it a direction. They just tell you that how to make it better, how to make it more appropriate for the situation. So that was the beauty of the organization. So it was a 4 months live project, as I told you. Whenever we would get a little time off our academic rigor, and since I was also doing a second project with Ruha Precision Systems Development, so whenever I would get time from these two, I would have a dedicated slot every day for Medtronic India. We would do a lot of secondary research, reading research articles, reading news, reading the statistics, where do doctors and patients mainly visit. And we later realized that patients are not the decision makers, it's the doctors that are the decision makers. And how to influence the doctors, where do they actually visit, what are the touch points that a doctor goes through regularly, and where can we put ourselves, where can we advertise, or where can we make them aware about the therapy, because the therapy cannot be directly advertised. That is one of the principles that Medtronic stands for as well. So we had to find routes where we can actually publish our articles, maybe get involved in some blogs which doctors go through, doctors read to keep themselves updated, so that they come across the technology and then they can suggest the patients that this is a therapy that is existing and Medtronic India provides it and you can take it. So this was a basically structure. So our secondary research of research articles, and a primary research talking to the patients, to the doctors, where do they actually go, where do they refer to the articles, and how do they come across new technologies and new therapies. So all of that was a part, and visit to hospitals, visit to clinics, visit to these API integration tools, actually using them, how to use them, and be more accustomed to the platform was something that we did. So it was a very good, enjoyable ride. One can definitely gather a lot of learning and experience by doing that, and we actually felt that we are solving a real life problem, and some of our solutions actually got implemented, and we were very happy that actually some of our solutions are physically getting implemented. So that is the value that they even give to an intern. If they like your idea, they will implement it on their platform. So that is the beauty of Medtronic India, and we were treated brilliantly. In fact, the interns that turned up to Medtronic India from VGSoM IIT Kharagpur this year also got similar kind of treatment. They got a great, internship stint out there. So it is one of the dream companies to be in, because you are solving problems of life. You are solving problems of science. You are using technology. You are, you are using artificial intelligence. You are using machine learning. The jargons that we hear, we are using it in real life to solve people's problems. And this is how you solve a case study. This is how you do a life project. You should have a meaning, you should have a learning, you should have an overall experience from it, which you can speak in your interviews, what you have been doing, what were the thought process that you gathered while going through that internship. So digital marketing, awareness campaigns about healthcare, therapies is something that one can dream of, and what better than Medtronic India to be in. So we were not working with the company on site, so I cannot tell you the on site experience, but the off site experience was extremely good. We had a couple of meetings, a mid review as well, with the leadership team. The head of people's function was also there. Apart from that, we were being heard of by the marketing head, the brand head. So they give value even to the interns. There would be a panel, there would be a team, there would be a mentor who would continuously have discussions on one-on-one with your team every week. And there was not a single institution that was a part of this. There were multiple institutions, and it was a competition. So every week they would be saying that this team is doing this team is doing this. So it would encourage you to come up with new ideas. It would encourage you to go beyond the limit, because you are fighting a live project competition, and this structure, I think, it should be followed by everybody. Nowadays we see case studies being floated, which is solved in 1 week or 2 weeks, at max 1 month. But real life problems are never solved 1 month or 2 weeks. We can give ideas, but I think live projects are more valuable. And live project competitions, when they come in and colleges compete among themselves with their teams, I think that gives more value, that adds more learning, that adds more value for the organization that is holding it as well, because they get good concrete ideas. And that is what I liked about Medtronic's approach. They organized a 4-month-long stint where they valued the people who were associated, where they would dedicate their top officials to interact with us, to give us what do they exactly want. And it was a two-way communication. So we would give some ideas to them, which they would implement, and then they would give some learnings to us, that this is how it should be done, or this is how it is done. And we would learn a lot throughout the process, and we would actually implement something, not only give ideas on case studies, but we will actually solve a real life problem over a period of 4 months. And at the end of it all, we would be competing with colleges continuously, and there would be a winner that would be adjudged. We were the national runners up there. The winner, I think, was IIM Indore, if I'm not wrong. Kudos to them for pulling it off. Till the mid review, we were leading, but due to certain academic rigor and certain other things, may you call it excuses, we were not the national winners, but we ended up being the national runner-up. But that's a great feat as well, because more than anything else, we learned, and that is the culture of Medtronic India that I got to face. That is how the live project was. 4-month enjoyable journey, great management, great support, great mentor. I would never forget her, how her insightful ideas, how her insightful sessions every week gave us an idea of how the marketing of the healthcare space is to be cracked. So overall, a great experience. They sent us a kit as well at the end of it all, along with some Amazon vouchers and a certificate that was framed. The beauty of it is it was framed when it came. So it says Medtronic India, Soumajit Chail recognized as the national runner-up of Level Up Medtronic India. So kudos to Medtronic India for pulling this off. You dedicate your top officials to this job, for nurturing talent, for giving a learning experience, and finally extracting something valuable from the top minds in the country. Again, kudos for pulling them off, and kudos to the team, for doing a great job across all institutes. So that was my experience with Medtronic India, a fantastic company to work with. I would like to be associated with more companies in the healthcare space, because that is what appeals to me as well as I go ahead, because I have worked with a couple of healthcare organizations now, and I feel healthcare is something that can really impact lives and is the future of India and the world ahead. So that was it from my side. If you like it, share it with your friends, subscribe to our channel, hit the bells icon for regular updates. Please let us know what videos do you want. Some more life experiences will be coming ahead. My current company life experience as well, I will be soon sharing on this channel. So keep yourself updated till then. And that's it for today. Thank you very much. Bye bye.